Okay, start.
Thank you, ma'am. So very good afternoon to all. On behalf of Association of Nurse Executives India, I, Lata Nonis, President of Karnataka chapter, welcome all of you for this Empower Hour on IPSC 3, Improve the Safety of Higher Lead Medications. The Empower Hour is a great initiative taken by Annie to empower the healthcare professionals with knowledge and awareness. This is conducted month on month, and it is our responsibility to spread about this initiative of knowledge sharing with evidences to improve patient safety. Now, it's my great pleasure to invite our National Vice President for Annie, Dr. Unmona, to grace the occasion with few words. Ma'am, Unmona, over to you.
Thank you so much, Lata, for giving this opportunity. It is my, I'm just sharing my slide. Just for a second. Hope I can share. Okay, it is my great opportunity to conduct this Empower Hour for entire year 2024. Yes, for 23 years in the foreign countries, it has been, nursing is honored as a most ethical and honest profession. But what about India? That day, one of my students was asking a guy who is working in the Michigan State University, for what reason the people need to go to the foreign country? She is a first year BSc nursing student. The person answered, to feel the most honor and empower. Otherwise, yes, salaries are increasing in India too, though it is not as much as in the foreign country. But for the respect and honor, but what I feel being in ANEI from 2017 and having this Empower Hour for the last 1 year, I am sure that every hour we are investing, for nurses to empower, there will be revolutionary changes will come, and nursing will be the one among the best nursing profession out of all professionals, and that will be the key. The root will be definitely ANEI. As today we are having the Empower Hour with the Karnataka chapter. Before that, I just would like to tell you things that already you know the vision of ANEI, that is to provide the leadership in the professional development, research advancement, and nursing service and education. So with this vision, we have our mission to work with the stakeholders, as we know that we are on the move of the unsiloing, so that we can make an impact for the patient safety and the better outcome of healthcare. As we know, all over the country, we have the different chapters, and very soon we'll be reaching to the 1,000 numbers. And this is the ANEI website. Anyone who is new can log into www.anei.in. And we are very proud. I'm very proud to share that national official for 2023 and 2025. Yes, very dynamic, versatile, strong. Ajita ma'am is the president, and I as a vice president, Unmona Borgohai, and Dr. Vinci Tiruvavan, she is the national secretary. Lieutenant Colonel Dr. Aji KL is the treasurer. But I should not forget to mention, we cannot forget the root and the mother and the parent of this organization, of course, Madam Thankam Gomez. She is always there. She is always with us, and very grateful to her, particularly for the Empower. She is always a backbone. And Madam Juti Clara, founder, national VP, and Madam Subhada Sakurikar, she was a national secretary, founder, national secretary, and of course, Madam Ajita was the treasurer for the last 10 years. And we have covered the Empower 2024. That is all done. Just, I would like to tell you the next series of Empower Hour 2025 will be leading by Madam Kawaljit Overoy. And this is something very exciting news for you all. Next series Empower will be ANEI Aina. That is for the young leader. Nurses Alliance. Objective of that, it has been taught by Madam Thankam and all of us together, so that we can engage the young nurses, their feelings, their inputs. There's students and young nurses both, because as we are from the generation is changing, generation G is running, like we are the millennial group, like a lot of changes may come, and looking forward for the more improvement for the patient safety and the outcomes. And for this Empower Hour will be a new chapter where will be at least two young staff nurses and two students will be there. And the topic can be decided by the whoever the presenting chapter, whoever will be leading in that particular month. And just to announce you, starting with the West Bengal chapter, February 2025, under the Kawaljit Madam. So I also have exciting news for you all, and hope all of you will be very happy to see this news. Please, please, please block your dates. 30 and 31st May 2025, Grand Hyatt Kochi, Kerala. So it is the place is beautiful, everyone knows it. But people who have not yet attended the Anicon, they will not know what the nursing leadership is. What is the collaboration is, what is the unsiloing is, and where is the bar we are raising to, how we are progressing to empower our nurses, how we are going to the topmost admired profession in our country. With this, I'm just concluding my tenure, also handing over to the Latha Nanis and also Ma'am Kawaljit Oberoi to lead the next session, next series. Thank you once again on this. I just want to thank Madam Thankam Gomez for being there always. Of course, Ajita Ma'am, every time, whenever I have issue or whatever support I need, she was always available. Thank you once again for giving me this opportunity to take this challenge. Hope I could do the justice to my work. Thank you so much. Over to Latha Nanis.
Thank you, ma'am. It was an excellent introduction by you. And thank you so much. Now, may I request the National President Annie, Ma'am Captain Ajita Nair, to say a few words. Ma'am, to you.
Thank you, Leda. Very good morning to all of you. Very excited to be here. Thank you, Dr. Unmana, for that versatile introduction. And thank you so much for leading Empower Hour for last 1 year. This is the 12th one of 2024 series. And we have had, engaging patients was the theme for 2024, where in each of these monthly presentations, we have had those who are at the receiving end of our care, patients, talking to us, and very fruitful discussions. And this is the last one out of that series. Very happy that Karnataka chapter is doing this topic on improving safety of high alert medications. To err is human, simple mistakes can be lethal. Very powerful message. And thank you so much, Dr. Ganesh and Dr. Sakshi Jalal, for being here with us, because we had been over a few years now trying to not only to talk to nurses that we always do, right? So we are not only now speaking to nurses, but along with that, we are speaking to other people, all our colleagues in patient care. So that what we believe now is that patient care can happen perfectly if only our vibes are all right, or we are at the same page. And that is the very idea of having these kind of programs. And all our programs henceforth will have this collaboration with all our colleagues, not only the nursing. And that is what our motto, this was a paradigm shift, of course, in our thought process. And in alignment with that is today's program. Thank you so much, Karnataka chapter. I'm not taking anybody's name, but Lata and team for making this happen. And back to you, all the best. Thank you.
Thank you, ma'am. Thank you. It was really encouraging to all to know about this, and meeting up with the president and vice president also. So here I take this opportunity to express my special gratitude to Annie National President, Captain Ajita Nair, National Vice President, Dr. Unmona, and Ma'am Tangam Gomes for all the guidance to conduct this Empower Hour. And also, I welcome Ma'am Kawaljit for the next year. Even I would like to extend my special thanks to Shaini Verghese, who is the Vice President of Karnataka, and Mr. Abdul Dayan, who is the Secretary for Karnataka chapter, to helping and supporting me to conduct this program. And my special thanks goes to, even I do not know her, but I have spoken to her, Asoma Devanath, who is extended the help to us. And you all will be, whoever is attending will be getting a certificate after the feedback. So I'm very happy to see all of you joined in large number to support this event. I can see already 345 people have joined for this. And thank you all once more and welcome all of you. Now, it's my time to request Shanti, Annie member, and CNO asked her to take it forward. Welcome, Shanti, and thank you all.
Thank you, ma'am. Good afternoon to all, and welcome one and all to this Empower Hour. Medication is defined as a substance used to promote health, to prevent, to diagnose, or to cure diseases, injury, if they are misused. There is 1 in 1 lakh chance of mishap in aircraft, but 1 in 300 chance of urged to use information technology to collect data to reduce and prevent medication errors. Adverse drug events like never events, sentinel events, near misses, etc. For every 100 hospital admissions, 6.5 experiences an adverse drug event. For every 100 medication errors that occur, approximately 1% harm the patients. 5 serious medication errors occur for every 10,000 medication administered. Where do this error occurs? We can see here. It could be from prescribing, transcribing, dispensing, administrating. In this also we can see administrating error is 38%. So it is huge. And here you can see some of the cost of adverse drug events done by studies done by JACO, Jury Verdict, and CA Healthcare Foundations. The National Coordinating Council for Medication Error and Prevention, that is NCCMERP, a national coalition of 20 organizations focused on prevention of medication errors, has approved this working definition of medication error. Any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of healthcare professional or patient. There are 6 international patient safety goals, and IPSG 3 is improve the safety of high alert medications. High alert medications are drugs that bear a heightened risk of causing significant patient harm when they are used in error. The consequences of error are clearly more devastating to the patients. The Institute of Safe Medications Practices, ISMP, have created the list of high alert medications which require special attention, monitoring during administration.
Shanti, you're gone into mute. Please unmute. Yes.
Now, let me introduce today's moderator for the session, Ms. Gauri Sai Sagadishan, who is an ANI member and also who is a TOT for patient safety by ANI. She is a faculty member for capacity building program and national safety in collaboration with ANI and ECHO, India organized by Maharashtra chapter. Gauri was the principal College of Nursing Fortis and presently working in clinical education with the Fortis, and also hold the certificate as national trainer for infant and young child feeding program. She have done many publications, both in national and international journals, and also published a midwifery casebook by JP Publishers. I personally welcoming you, Gauri, and request you to take over the session.
ಏನೇನ್ ನೋಡ್ತಾರೆ ಏನೇನ್ ಮಾಡ್ತಾರೆ ಗೊತ್ತಿಲ್ಲ ನಾನು.
ಇಲ್ಲಿ ಬಂದಿದೆ.
Miss Gauri?
She's on mute.
Gauri, can you unmute, please?
Yeah. Sorry for the inconvenience. Good afternoon to all. Thank you, ma'am. I am very excited to be here as a moderator for this national forum. I am grateful to Annie for conducting such events, which gives real empowerment and confidence to many healthcare personnel. Karnataka chapter has taken the topic as the error is human, simple mistake can be lethal. IPSC 3, improve the safety of high alert medications. I am sure it is very apt for the day-to-day requirement. Now, without delay, let me introduce the panelists for today's discussion. Dr. Ganesh Manjunath. Dr. Ganesh is working as intensivist in Fortis Hospital, Banarkata Road. He has completed critical care medicine super specialty training in 2019 and joined Fortis BG as consultant. He has done many publications in national journals and presentations in national conferences. His areas of interest is in hemodynamics management and caring for the critically ill. It's my extreme pleasure in welcoming Dr. Ganesh. Next, let me take the opportunity to welcome Dr. Sonali. Dr. Sonali is Dean and Principal at Ramaya Institute of Nursing Education and Research. She acquired a PhD in 2017 from National Conservatorium for PhD in Nursing, New Delhi, India. 20 years of work experience includes working as a bedside nurse, academician, researcher, and administrator at a nursing education institution. She has served as member board of studies, Rajiv Gandhi University of Health Sciences, a state university for 2 terms, and has been closely involved in curriculum planning and implementation work of the university. Her recent publications include 20 research and review articles published in reputed journals. She is also a co-editor for a book titled Clinical Nursing Procedures, The Art of Nursing Practice, which is also translated in German language. She recently completed a policy research project on NCD risk reduction education in undergraduate nursing curriculum in India, funded by Access Health International, New York. Findings of this project were presented to members of NITA, National Institution for Transforming India, IOG, New Delhi. She has also completed a fellowship program from ICN in Global Nursing Policy Leadership 2022 cohort. It's my extreme pleasure in welcoming you, ma'am. Now, let me take this opportunity to welcome Lieutenant Colonel Suma, KS, is General Manager, Nursing in Apollo Hospital, Banarkata Road. Previously, she worked as Chief Manager, Nursing Services at Manipal Hospital, Chief of Nursing at Sagar Hospital, and worked in Military Nursing Service for 21 years. And also she worked as Principal College of Nursing, AWES, Jalandhar, on deputation from Army. She holds MSc Nursing from Christian Medical College and Hospital, Vellore, Masters in Psychotherapy and Counseling from Institute of Psychotherapy and Management Studies, Mumbai, Masters in Clinical Research and Regulatory Affairs from Sikkim Manipal University, Postgraduate Diploma in Quality Management in Healthcare from Symbiosis University, Pune, Executive MBA in Healthcare Management from Apollo Medvarsity. She has received many awards and she published a study to determine the effect of Reiki therapy in reducing effectiveness communication board on level of satisfaction. I will Dr. Sakshi, presently working as quality manager in she holds BDS degree from AP Shetty Dental College, Mangalore, MBA in Hospital and Healthcare Management from IIHMR, Jaipur. She is certified personnel in Lean Six Sigma Green Belt. She is passionate and dedicated patient safety professional with 7 years of experience in healthcare. She was a part of development of many SOPs and documents in Fortis Hospital, Banarkata Road. She did a QAP on extending critical care beyond ICU doors
received IHH Clinical Excellence Award on QIP, improving occupational safety among healthcare workers and environmental safety by reducing hourly consumption of inhalational anesthetic agent. I welcome you, Dr. Sakshi.
Thank you,
All
ma'am.
of us know patient is the center of healthcare. And without a patient, no healthcare. Patients don't care about our policies, but they care about how we treat them. A satisfied customer brings many more. We have today a representative and a patient advocate as a panelist too. That's none other than Ms. Sasikala, who is a healthcare person. It's our privilege to hear from you and welcome you, Ms. Sasikala.
This discussion.
Now we will begin our panel discussion. Now we have the panelists here. I extend my heartfelt welcome to all the panelists. Hear from them. Even though there are policies and protocols in place to prevent the medication error, it's a well-known fact that there are medication errors happening on the ground and very less percentage is reported. And now I request each panelist to take 2 to 3 minutes for the each questions. Now the first question goes to Dr. Sakshi. As a quality manager, share your view on reporting of medication error and how we can emphasize to improve the appropriate reporting. Over to you, Dr. Sakshi.
Thank you, Madam Gauri, for the warm introduction, and Lata ma'am for this opportunity. I will answer first question in parts. The first half, the answer to the first half about sharing my view as a quality professional on reporting of medication errors is that reporting of medication error creates an opportunity for improvement and mitigating a risk before it converts into an actual harm, which no healthcare organization can otherwise afford. Also, the more number of errors reported reduces the likelihood of same error happening in future. So that is my view as a quality professional about reporting of errors. Now, the second part of how to ensure appropriate or effective reporting. Well, by encouraging non-punitive reporting, which most of us anyway know that is the key to improvement, by being appreciative of people for self-reporting of an error and acknowledging people who are reporting errors for improvement. For example, at Fortis, we had a spot moment for hand hygiene where those who reported maximum number of incidents related to non-compliance related to regarding hand hygiene were felicitated so that people would come forth and report error of any sort, not limited to any department or any person. There should be a mechanism of preventive audits in the hospitals rather than corrective interventions. We should encourage anybody and everybody who reports an error, and error should be reported within a stipulated time frame so that the purpose is of investigating an error is not lost. We should not wait for anybody raising an incident, an error that whenever an error happens, anybody can come forth and raise an incident report. Also, while investigating an error, it should be done in a holistic manner. It should not be limited to few members or few stakeholders. Everybody involved should be encouraged to come forth and help in conducting an RCM. We should make reporting process easy, and we should also respect if anonymity is asked for, so that whenever an error is reported, nobody should feel they are at a sense of feeling threatened against getting any punitive sort of punishment from the management. Also, we need to increase risk awarenesses. For example, if there is a near miss which did not cause any patient harm, so it should not be thought that it can never lead to any adverse event. And also, most of all, we need to provide feedback to ones who are reporting an error. They should feel encouraged and heard. So even if we were not able to investigate it and provide them with the result that they wanted, but they should be acknowledged by giving them a feedback and letting them know that whatever was raised was dealt with. We need to offer support and concern during during an occurrence of self-reported an error. I hope I have explained the first question.
Now the next question. Previous.
Does not.
Okay.
Question. Yeah.
The
Can you
next
explain
question.
Sakshi, can you explain the requirement by the accreditation bodies on management of medication error?
Yes, thank you. Accreditation bodies want us to have an SOP or policy, as we call it, on incident reporting, inclusive of reporting medication errors. It requires us to have categorization of errors into near misses, adverse event, and a sentinel event. At Fortis, we have categorization from A to I, which includes the duration of harm and how soon did was the patient able to, or anybody having an error could go back to his or her normal self. Sentinel event to be reported, all sentinel events for that matter, to be reported to the accreditation bodies. They want us to have a standardized format for reporting and conducting RCAs. All the information should be recorded and documented, and the data should be analyzed in order to identify opportunities for improvement. The best and the most which is expected by the accreditation bodies is communicating corrective and preventive measures to all the personnel involved. Like I said before, all stakeholders should come as a team and help in framing a CAPA for any error. And most of all, communication about like I said, communication about these kappa, which is the key to a strong foundation. So that is to be conducted. So they want us as an healthcare organization to foster a culture of safety, which includes promoting the reporting of errors without fear of retribution. So that's what is expected of us by the health accreditation bodies. I hope I have answered the second question.
Thank you, Dr. Sakshi. It's really enlightening information as a quality perspectives. Now let me move to the next panelist, Dr. Ganesh. Dr. Ganesh, let me ask both the questions together. Sir, as an intensivist and handling a large critical care unit, would like to hear from you on how to implement safety of high alert medications. And the next questions, also please explain the potential impact if a medication error occurs, and how will you inform the patient and family about the error with transparency and honesty? Over to you, Dr. Ganesh.
Thank you, madam. My audio is okay? Right. So the first question, coming to the first question, it's not only in the intensive care, anywhere in the hospital, any medication given to a person who would not require it will become a error. And all the medicines, including a simple IV fluid, can be and is and must should be considered as a high alert medicine, because if somebody does not require an IV fluid and if you give a lot of IV fluids, that becomes an error on the part. So in that case, in the ICU, coming to the ICU per se, we have a very robust training program in the hospital. So many of the nursing candidates, before entering the ICU, they undergo vigorous trainings and in about not how to handle these drugs. And in the ICU, we have the seniority and hierarchy based sort of implementation. So for example, let us take about KCL. Okay, KCL, when given too fast, KCL is potassium, right? So when given too fast can be life threatening. At the same time, it is a very important medicine for the ICU patients. So before loading, all these medicines are kept in a locked cupboard, so that without specific order, these medicines are not being utilized. And then a senior is always overlooking a junior who is administering these medicines, starting from the loading part. So once the medicine is loaded with the proper dilution, as of course with the orders of the doctors, then this medicine is first labeled with a color coded label. So that means the very high alert will be having a red color code. So that means it's a high alert one. So after that, during administration also, there is a specific rate over which these medicines has to be administered. I'm just talking about KCL because it's the simplest one. So if we give it too fast, arrhythmias can happen. So all these, basically it has to be training, and reiteration of the same thing. And the other thing is, if somebody is doing an error or a mistake, it should be the responsibility of the seniors of the same unit to not criticize them. Instead of that, give a positive reinforcement and tell them that this is not how it's supposed to be done, and how to properly administer these medicines. So high alert medicines, there is a lot of medicines. KCL is the only one of the examples I have taken, but any medicine in the ICU is a high alert medicine. Color coding, proper training, and the supervision will be the most important safety precautions I would take in administering these medicines to the patients. And of course, the doctors also should be overlooking at how these things is happening at the bedside. I hope the answer is satisfactory to all of you.
Thank you, Dr. Ganesh. It's really a powerful input as an intensivist perspectives. Thank you so much. And next,
Yeah, the second question, if a medication error happens and the patient is suffered, right? So that is the, when it comes to the hierarchy of the errors, that comes at the topmost, right? So we should always be transparent and honest. So there is something called duty of candor towards the patient. So whatever has happened, error, be whoever it is, we should go and be transparent with the patient and the family, and we should tell them such and such event has happened, and we should be transparent and we should be honestly telling it. There's no need to hide saying, oh, it could have happened, it happened, why it happened. There's no need to give all these explanations. The duty of candor is towards maintaining transparency and honesty. And during these episodes, the patient relatives or the patient, they can ask, who was mainly responsible? Was it the nursing staff? Was it the junior most nurse? Was it a night duty nurse or a night duty doctor? So we need not pinpoint and say that happened, that is because of that person's error. We should just say it is a teamwork, and as a team, there is a mistake which has happened. And in case, sometimes they'll ask, so what next? Are you going to do something for this? Will you compensate? So all those sort of questions, it's not our responsibility to answer. We should just let it for the administration team, and along with the administration team, we can answer their questions regarding that. Because the moment you say it will be compensated, we'll do something else, that means that it is you're guilty, and you knew this the mistake is going to happen, and you still did it. But these mistakes, because of errors, if it happens, it's a mistake. It's not something which and you are going to do it. So do not, maybe we should not be saying that we'll give you compensation, so just forget about it. No, be honest, tell it's an error, it's a teamwork. Need not pinpoint at the junior most staff who's done it. It's a responsibility as a whole team which we have failed, and we have to face the consequences however it takes us.
yeah.
Is it okay? The answer was
This is Dr.
satisfactory
Ganesh,
to you?
really, it's really very nice, and all your comforting words, really will make confidence to all the people
Yes.
who are sitting and listening here to report about any errors too. Thank you
And
so
then I
much.
would like to just thank all the nurses for all their work. You are the backbone of the hospital. We, as a whole community, not only doctor community, as the entire society, we respect. Even in India, every healthcare worker, including a nurse, is respected, and their work is, we are indebted forever for all the help you guys do. Thanks a lot.
Thank you, Dr. Ganesh, for these motivating words. Thank you so much. Next question goes to Lieutenant Colonel Suma ma'am. Ma'am, as a nursing head, what is your thought process on prevention of medication error and what innovation have you introduced to minimize medication errors? Over to you, ma'am.
Thank you for giving me this opportunity to talk in this forum. As a nursing head, if you see, whenever there is a medication error that happens, okay. So first we will talk about the prevention of medication errors. There have been a lot of innovations that many hospitals have introduced and they have been doing, like, say, for example, they will keep on insisting to follow rights of medication administration. Then they will have a separate medication nurse or allotting a separate place, having a sash so that no minimum disturbances and distractions happens to the nurses during that period of time. Then they also insist on, especially higher drugs, there should be double verification right from the time it is the medication is started till the patient gets connected. So there should be double verification. Then explaining patient and attender so that, and taking an acknowledgement from them. So because many of the patients may be chronic patients and they may be taking medication. So if there is any slip, it can be prevented. And some of the hospitals do follow closed loop medication medication so that you can zap and it will help you to prevent errors. So apart from all these things that has been implemented, we recently came out with the study which we conducted, which was called as a medication error encouragement training. So this we started about 6 months back. The aim of doing this is the idea behind doing this is making the individual responsible and making the nurse understand the implications of medication error and the harm that happens to the patient. This is basically we are providing with a lot of case studies and scenarios. It's a sort of a simulated learning which aims to reduce the actual medication error, because we are presenting the case studies which has such errors which has happened across the globe, and as well as some incidences which has occurred even inside the hospital without naming anybody or without naming the department, without naming a hospital. We just tell them that, and then we have a discussion, open forum discussion as to what could have been done and why this has happened. So it gives a lot of insight to the nurses, and then they maybe it is to reinforce them and focus them, and it is not a one time thing. It has to be it's an ongoing program that we conduct so that the staff are aware of what the medication is. The previous speaker, when he said, we have different type of medication errors. It can be prescription error, a transcription error, a dispensing error, and an administration error. Of all the errors, the medication administration error is considered to be more lethal because it directly reaches the patient. And a vigilant nurse and a very careful nurse who is very focused on her work will be able to prevent other errors if she is very vigilant when she is providing this. So this should be an encouragement training, and we are able to substantially reduce the medication error by following these steps. Thank you.
Thank you, ma'am, for throwing light on so many innovations. Ma'am, again, next questions to you. Can you highlight on the steps that you will take if an error occurs, ma'am?
So first and foremost is that any medication error occurs, it is more stressful to the nurse administrator than even the nurse who has done that mistake, because you will be facing the wrath of the patient and the attender. Then you will have to answer to the doctors, then to the management. So it is much much stressful and a very emotional moment. Like every day, I think all the nurse administrators will definitely agree with me that every day they pray that such incidents should not happen. But when it happens, we have to, what to do is we should though we say that it should be a teamwork, everyone should be called, but I think we should have a private moment with the nurse who has done that and sit with her and understand what has happened, what led to that, so that you give a chance for the person to tell it out, to speak it out as to what exactly has happened to her. and what made her do that. And we also need to find out whether there was any process deviation that has occurred. That helps you to doing a root cause analysis, what process deviation has occurred. And also just not one-off incident, whether such type of process deviations have occurred which had resulted in a near miss event. That means we have to reflectively look into that particular process, and we need to strengthen that process. Like, I'll just give you an example. In one of the corporate hospital, there was, a lookalike drug which was kept along with another drug, which was that lookalike drug was anesthetic drug. Another one was a drug after LSCS, we give it to control bleeding, that is methergine. So this was kept together alongside, and it was look alike. And the nurse, instead of giving methergine, took and gave this anesthetic drug after the LSCS was done. But it was identified by the anesthetist the patient had, so he could give, the patient had gone into deeper sedation, and he had to give an antidote for it and reverse it. So such things can happen, and then in that case you will have to sit and look at each process, why that has happened and how we can streamline it. And apart from doing that, that person who has done it, and especially if that medication error has caused some harm to the patient, and so it is, if that it's a lethal thing that has happened, we should also give some sort of an emotional support. So we have something called as an ESCA. We say like an emotional support to care givers. That is what we have for the carers. So they need some emotional counseling that needs to be done, so that they get rid of that guilt, and that is how we handle them. Thank you so much.
Thank you so much, ma'am. As a CNO, really you have highlighted the day-to-day challenges, how to manage in the real scenario with the real examples. Thank you so much, ma'am. Now, the question goes to Dr. Sonali, ma'am. Ma'am, can you explain the policies in place to educate nursing students about medication safety? Ma'am, and also the second question, can you also throw light on simulation training to prevent medication errors? Sonali, ma'am.
Thank you for your questions and good afternoon to all. I think the training parts always remains very critical to prevention of medication errors, which is a very critical patient safety aspect that we have been considering in the hospital. I would focus my answer for the first question on undergraduate program. As I think many of you must be aware, the undergraduate program is now, the curriculum is revised by Indian Nursing Council, and we call it as a competency-based curriculum, which is a very welcome change. For general nursing and midwifery course, there are across the course that I took a look yesterday, 50 hours of medication administration training across all subjects, and for BSc nursing, 62 hours of medication administration training across all the subjects in the 4 years of program. That much time is allocated in the curriculum. How the training actually happens is generally there is some theoretical component. Of course, it's less, around 30 to 40%, and the practical component of training is around 60 to 70% in the curriculum. The students are taught about medication administration in the classroom first, and then they are taken to the laboratory and they are demonstrated how to do different kinds of routes of administration, dosage computation, what care should be exercised while administering certain common medications that are prescribed on the wards for the patients. And then the students are asked to do the written demonstration and practice the skills in this demonstration lab on mannequins. Following this, we of course have students posted in the clinical area. As you know, the curriculum has almost 60 to 70% now. The revised curriculum is clinical component. Provided the colleges are really following this, probably we should be really able to make up for the required skills that are expected of students. That is very essential to follow what is there in the curriculum. So when the students go to clinicals, they generally administer simpler medications first under the supervision of the clinical instructors or senior nurses who they are buddied up with in the wards. In practical, in several hospitals, there are hurdles like, they don't have their own clinical area. Sometimes, even if you have a parent hospital, there's a little hesitancy from the nurses' side in permitting students to do this hands-on with the patients. But I urge that I think the clinical side nurses and the education nurses need to come together to handhold the student nurses, because if they have these kind of at least some experiences during their training to administer medications, they would develop on their confidence. So that's very critical. And after the students do this under the supervision of either a senior nurse or a clinical instructor, the administration of certain medications by certain routes, they are required to have the competency certified by their clinical instructor in their logbooks. So that's a usual process that is followed. Apart from this, I think the new curriculum also offers an opportunity in the 8th semester, especially in the BSc nursing program, and the final year, last 6 months of GNM training is an internship component, wherein I think at Ramaya, what we are doing is we are posting the students completely under the nursing superintendent. They are buddied up during their internship with the senior nurses in the hospital, and they are assigned simpler patients, and they do these basic procedures of administering basic medications, IV fluids, and other basic nursing skills. It's a supervised practice for 6 months that probably provides them with a great confidence. I think wherever these opportunities are available, people must adopt it. The new curriculum also asks at the end of the 8th semester, there's a competency assessment examination is to be conducted for the BSc nursing students. Now, this examination has a total of 200 marks, and as per the new regulations, there are required to be 5 assessors to conduct this examination, out of which 2 can be from education side and 3 has to be the clinical people with clinical experience. I think this is a great opportunity where you can have I think it's the College of Nursing who needs to chalk out a plan as to what skills would they include as a component of this competency assessment. And definitely, I recommend that medication administration has to be one of it, because it's the most critical work that the nurses, as novice nurses, do at bedside once they are hired by the hospitals. Of course, so that would help to analyze and assess their skills, how good they have become end of the program. And if there is a lacunae there, they can be provided with additional training. Of course, on completing their training, I think hospitals, of course, very good hospitals already have a transition training program, or they call it as induction training as of now, which is also a very essential component. I think in addition to that, there is a WHO patient safety curriculum available online. There are modules for students to take up, and medication administration is one of the module, which I think most nursing colleges should take an opportunity to have their students to take up this module, which might help them. Additional thing that at Ramaya, what we did last year and this year, we are again going to repeat that, is we have an advantage of having our own pharmacy college here. So we collaborated with the pharmacy college and we had a workshop conducted for our students. We just looked at very common medications that are prescribed on the wards day to day, because basically as a novice nurse, nobody really directly posts them in a operating room or in intensive care unit. Generally, they get posted on wards. And basic kind of medications, whether it's antibiotic, analgesics, or antihistaminics, whatever are prescribed on the wards are across the patient more or less similar. So we just created a list of common medications that are administered on our wards in Ramaya. And we had this exercise done with our students along with pharmacy college to educate them more on those medications. And had them hands-on practice of loading those medication, injecting them into mannequins, some of them which come in powder forms, to reconstituting those medication, because I think those hands-on skills are very important to gain confidence. So I give a lot of credit to my faculty. Actually, they worked hard to design, and also Pharmacy College helped us in that. So these are some of the, I think, procedures and policies that can be followed for educating students on medication safety. That's the answer for your first question. Coming to your second question, simulation, of course, it's a era of simulation now. Since I reviewed the research evidence, what is available for simulation. There's plenty of research evidence that's available on internet today, articles that are published that are speaking that simulation training can do a lot of good in improving the medication administration practices of students, especially with regards to safe practice, because it provides an opportunity. Simulation provides a opportunity for students to safely practice their skills without having any fear, and even the instructors don't have to get worried about what if she makes an error. So it's a good area of practice. Also, simulation provides them an opportunity to develop proficiency, the actual skill in doing it. It also can help them develop critical thinking skills, because as I think one of the previous speaker, the doctor was mentioning that when you administer a certain medication at a faster rate, or if you administer it instead of a drip, bolus dose, what difference it makes to patients. If you have a high fidelity mannequins, it can actually depict that. If an error happens, what happens to the patient's heart rate, what happens to the rhythm of the heart. I think that's a great opportunity that can be available through simulation. Another studies that I referred, they also spoke of dosage calculation. There's an opportunity in simulation to have them rehearse, especially when it comes to pediatric settings, to have practice in dosage calculation. Studies have also shown that students have drastically improved their practices with regards to following the 6 rights of medication administration. With regards to availability of such facility, of course, I think one good thing that has started is the Indian Nursing Council has started training of faculty in nursing colleges in simulation at Guru Gobind Singh University, and INC is actually sponsoring the faculty all over India to undergo such trainings, and I think people should take benefit of it. There are, of course, very few nursing colleges may have a very high-end simulation laboratories as of now, but I think universities should make an effort to set up such laboratories and also train faculty in simulation training. And another thing that might hinder is, again, faculty shortages, because when it comes to simulation, we need to have a training in small groups, and you require a more number of people for such training. But I think apart from these challenges, it's a great way of taking up medication training. I hope I answered your questions.
Thank you so much. Audio. Thank you so much, ma'am. Really, you highlighted very nice way how our really, I'm sure our future angels will be strengthened to face this challenges of medication error and managing the medication management. Thank you so much, ma'am. Now, let me welcome Ms. Sashikala. Sashikala, a patient advocate. What is your experience about medication error, and how did the team help you to overcome the situation? Can you please narrate it, Sashikala?
Thank you for the question. My mother had undergone coronary angioplasty and she got discharged without any consent. On the 3rd day, she had developed some allergy reaction and we moved her back to the hospital. The doctor examined and informed us it is a simple allergy and nothing to be panic. We'll give some medication to subside the allergic reaction. We'll observe her for 2 hours. Later, she can ship back home. Since it was not so serious, I was comforted. I was on the phone to give information to my relatives that at the same time the nurse came and inserted cannula and administered the injection. Suddenly, my mother became breathless and had tachycardia. At the same time, that time I asked the nurse what injection was administered, and she informed that doctor ordered injection adrenaline and hydrocortisone. I rushed to the doctor and I understood that the injection adrenaline was supposed to be given as subcutaneous, but the nurse have pushed as IV. That have caused breathlessness and tachycardia. The entire scenario was changed in few seconds and she was shifted to the ICU. The entire family was under tremendous pressure. Still, when I think, I feel that the scenario was in front of my eyes. But I should thank the entire team for taking care of my mother and helping to bring her back to home with good recovery. Yes, like this, I'm sure like this education sessions will be an eye opener for many. Yes, the entire doctors were very transparent while in explaining the conditions on day-to-day basis. We had multiple discussions about the recovery of her. Even the management came and apologized and informed us that the process change done in their organization. Now I can relate what they spoke was very true and it is the requirement of the day. My request to all of you will be please empathize and follow all the safety precautions. Thank you all for the opportunity given. Special thanks to Annie for making me a part of this discussion.
Thank you, Ms. Shikala, for sharing the experience. And it is really an eye-opener for all of us. Now we have come to the end of our panel discussion. And I extend my heartfelt thanks to all the extreme valuable panelists for your valuable contribution. And just to highlight, our panelists have explained the points of different types of medication errors like prescription, transcription, including dispensing and administration errors. And also we have understood from our panelists the management of high alert medications, how to do the storage, safe order, safe dispensing, and acknowledgement, safe preparations, verifications with double signature, safe administration, monitoring, and documentation. And also we understood how to take care of the high alert medication safety by red dot, and it is stored in a separate cupboard under lock. And especially the high concentrated electrolytes are stored in specific places under lock. Double check done during preparation and administration, and it will be documented with witness signature. And also from our quality manager perspectives, we understood the different categories of medication errors, where from the category D to I, RCA and the COPPA. And also finally, to conclude with the main tips of the medication management, we can follow all the rights of medication, prepare medications for one patient at a time, confirm patient ID using minimum two patient identifiers, confirm the correct medication, check for allergy before administration, prepare the medication according to the order and dilution, administer the medication, document then and there. And this particular slide, when we look into that, there are 10 processes of medication management. But when we look here, there is 7 processes completely managed by our nursing fraternity. So we can understand how important the medication management for nurses. So next. So now we have come to the conclusion. Now let me hand over the forum to our Madam Latanonis, Ali, President, Karnataka Chapter, CNO, Kotis, Karnataka Road, Bangalore.
Thank you so much, Gauri, for that. And to all the participants, we'll be sharing the link for feedback. Please complete that so you may get the certificate. I take this opportunity to thank you all the panelists for taking time from your busy schedule. And by listening to you all, I'm sure that all of us have to take an accountability to perform a proper medication administration by following all the mandate of medication. And thank you all participants for patient listening. And I'm sure that almost 500 of them had joined for this. And I'm sure that you all have earned some knowledge on steps on safe administration of medication. So now may I request any senior leaders like Ma'am Majida or Ma'am Thangam to have a closing remark for Karnataka chapter.
May I request Lata to stop sharing, please? Thank you.
Yes, ma'am. Thank you.
I'm not sure if Ajita is here, our president. So we have another meeting about to start, so we don't have much time. I would only say thank you so much to all the Karnataka chapter panelists, and a very, very special thanks to Shashikala for sharing that story. And I think that is the key need of the hour. Yeah.
Yes, ma'am. The feedback is in the chat box, ma'am. I think that
Okay,
all of
that's
you-
for all of you to access the feedback. If you want the certificate, it is 1 or 2. I'll just take 2 minutes. We're really very, very sorry that we are rushing because we have another meeting to go to. We need to respect the time of others because the Empower is for just 1 hour. So without wasting time, I would like to say thank you to Shashikala for coming here and she rest all the things we keep doing all the time, but we do not hear directly from patient and patient relatives. And such a powerful story, subcutaneous adrenaline given IV, we are not getting into the root cause, but it is so very kind of you to come and share your own story. And this is called, proper disclosure. When a mistake happens, we go and tell the patient that mistake has happened and this is what we are doing. And I hope this culture will start building in our hospitals to make, without communicating with patients and family, we cannot achieve patient safety. So with that, I would like to invite you all to Anicon, and I'm going to run a very, very short video to attract all of you to, I hope all of you can see my screen.
Yes, ma'am.
Okay, so we inviting. So thank you everyone. So please save your dates for 31st of May 2025 and see you all at Kochi. Once again, thank you, Nonis and team. And bye for now. Thanks, Dr. Unmana, for holding the fort for the entire year, and welcome Madam Kamalji to continue with the generation in the coming year. Thank you. Not coming year, this year. Thank you so much.
Thank
Bye-bye.
you, ma'am. Thank you. Bye.
Thank you all. Thank you, ma'am. Thank you, senior leaders.